like students like trying to copy the Wiggers diagrams, but if you have a great understanding of how the cardiovascular works, you could able to draw that graph really easily. Okay, let's just talk about this. So usually what happens, we're talking about the pressures and volume, right? And then obviously the time. So what is happening in the, we have to remember what is happening in the aorta, what is happening in the ventricles, and what is happening to the. So if I say, let's say this is about like, let's start with, let's say this is about like my 5 millimeters of mercury, and we'll go and make this one as, let's say like, let's go with like this, a 15 and 30, right? 45, 60, 80, and let's make this as, okay, I'm not gonna go all the way down, but let's just think about this one as like my 120. Let's go with that. Actually, you know what? Let me make this a little simpler. This is going to be 45, 60. This makes us 80, right? And let's say this makes 100, and then let's make this 120. Okay. Now, obviously, this is going to be my pressure, right? And then time. Now, what is happening in the atria first? Let's use the different colors for this one. In the atrial contractions, right? In the atrial contractions, the first phase was my atrial contractions. What is happening to the pressure on the atrial contractions? Okay, so when the atrial contract, what happened is that it made this structures like this. Okay, atrial contractions, right? This is, I'm talking about pressure, right? So it kind of jet like a pressures, and the other thing it did was, after the atrial contraction, what happens with your isovolumetric, what is it? Contraction, right? At that time, when the isovolumetric contraction, what is happening with the atrium? I'm just talking about atrium right now, okay? I'm talking about atrium right now. What is happening with the isovolumetric contraction? Atria just working as a tank, right? It's just receiving the blood, right? That's what atria is going to be, just receiving the blood, or it's going to make some kind of sound, because it's just going to be, because when the contract happens, there are balls you see, right? That's going to be the essence of, but this atria is just working as a tank that time, so you'll just see the blood going up like that. Okay, so you just accumulate the venous blood all the way down. That's what, because remember, atrial diastole is longer. Atrial contraction only one phase, so this is just like venous blood receiving, and it's working as a tank. That's why atrial contraction is happening, right? Now, other thing is that if I talk about the ventricle, what is happening to the ventricle? Let's say this is also like pressure on the ventricle. It kind of goes up like this, right? It kind of goes up like this, right? The ventricle, and then isovolumetric contraction. This is where you produce the jet-like structures, right? This is where your first S1 sound is produced. And if you look at this one, this your mitral valve is open up there, right? And then what happens? This is where your mitral valve closes right there, right? And it produces the sound like this is where your S sound is. And then what happens? It will start contracting, keep going. It's gonna keep going. It goes all the way up, right? And it will go all the way up, and when it reaches down here, let's make this one. It reaches down up here, about 81. What happens is that this is where the aortic valve opens, right? And this phase we call them as a isovolumetric contraction, right? Look, and I'm referring this as isovolumetric contraction right here, making this diagram. You can make it this like this, so, okay? And the other one is called, let's say if you're talking rapid ejection, rapid ventricular ejection phase, right? So because of that, what happens? This is going to keep going and keep going up. So it will keep going up till, let's say, make it this 120 here. Go up all the way down to 120. Okay, I'll just make it the rapid passive ventricular filling. Okay, and all the way down. Then after that, what happens? This will start coming down. It start coming down here, and around like about 100 something call. What happens is that these guys will close, and this is where you have aortic valve closes now in this phase, about like 100, 104, and then still these guys start coming down here. This phase is called my slow passive ventricular, not filling, sorry, so what is slow passive ejection phase, right? It's slow ventricular ejection phase, and this is going to be our slow ejection phase, right, for the ventricles. Come down, and then as the pushes down, come down, right? These guys right here, I'm representing this one as my isovolumetric relaxation. Now I'm going to this referred as, from there keep going down, isovolumetric relaxation is going to come down and come all the way down, all the way down, all the way down, and then as soon as when the pressure becomes atria high, what happens? There's a rapid passive ventricle filling happens, and then you'll have a other one is a slow passive ventricle filling is going to happen. So basically sort of like the ventricle graph sort of looks like that. All right, you know what, let me just not even make this as diacritic, maybe that's aortic thing. Let's just make that. Now what about the aorta? If I make this aorta with, let me use a red color, what is happening here is the aorta. As it come down here, what happens? This is where the aortic valve opens up, right? And then remember, when the pressure goes up, the aortic valve pressure also goes up like this. And then it's come down. As this ventricle pressure is coming down, what happens? This pressure also comes down. But when the aortic valve goes, it produces like sort of like a Dutch-like. So this is called dichrotic notch. Okay, and then it becomes like this. That's your aorta. Now, what about the EKG? What is happening there? Let's now put the EKG there too, right? Remember, this is electric, or this is a mechanical event. So mechanical event always happens after. First happens your electrical event. So when the atrial contracts happen, obviously this is, let's just C and this is C wave, right? Whenever the atrial contracts happens, you start from here, right? Like this. And then you'll have this, which is a C wave, and then obviously in the isovolumetric contraction, this is where you're going to see
listening.
So atrial contraction, right? So when the atrial contraction happens, this is going to be my P waves, right? And the AV nodals, that's what's happening. And then obviously, isovolume contraction is where you're going to have the QRS complex, right? And then this is all rapid ejection phase and go all the way down, and from the relaxation phase, from all this relaxation phase, from the isovolumetric, that's what the T waves is, and then you can have relax, and then next starts. Okay, let's talk about quickly about the volume. Okay, what is happening in the volume of the ventricles, especially because that's very important. When the atria is contracting, I'm just going to quickly use this here and talk about volume, right? What is happening in the volume in the atrial contraction, right? Volume was what? Volume was in the atrial contraction. The ventricle is working as what? Tank, right? So obviously the the volume was up like that, right? Up in the atrial contraction. Whenever the isovolumetric contraction happens, volume was decreasing, correct? And then when you have a rapid passive ventricle filling, there's more decrease. Slow passive, there's more decrease, right? So all decrease. So this one represents, let's say, a passive ventricle filling, right? When the volume of the blood is there. But then this phase, when isovolumetric contraction, the volume of blood is ejecting. Passive ejection phase, the volume is decreasing. Slow passive volume is also decreasing. And then whenever there's isovolume relaxation, there is no difference on the volume. And then after that, what happens to the volume? Okay, let's draw this a little better. Let's draw it here. So what happens? The volume of the blood it's up, right? And then whenever the isovolumetric contraction happens, the volume of the blood starts decreasing, right? And then when you have a rapid passive, it will decrease even more. And then when you have slow, it decreases even more, right? And then when you have a isovolumetric relaxation, your volume of the blood stays the same. And then from the rapid passive, it goes up, and then you have what is this? It's slow passive ventricle goes up, and then you have a atrial contraction volume goes up, and the isovolumetric relaxation. So it looks something like this. See, this graph represents the volume. Look, volume is, let's say this is my volume of the blood, right? So during my atrial contractions. So when would be, so just think about this way as whenever the isovolumetric contraction, when you're ejecting the blood, your volumes are decreasing, and this represents rapid ejection phase, slow ejection phase. And this is where your isovolumetric relaxation, where no volume of blood is changing because both the valve is open, both the valve is closed, and then after that, what happens is that there's ejection phase, right? So this is a passive ventricle filling, and again the volume starts going up, and this is slow passive ventricle filling, and then this atrial contraction, okay, because atrial contraction is still filling the blood, right? It's still filling the ventricle, the volume of the blood, and then this is going to be my isovolumetric contraction, because volume doesn't change here. Memorize. This is what the atrial valve opens. This is what the atrial valve closes, right? And then down here, this is referring as isovolumetric relaxation. This graph is right. And down here, this is again mitral valves opens up, right? And then when your mitral valves opens up, what happens? The mitral valves you got to bring all the way down this way. Maybe sorry, this graph is like, I kind of didn't do this, but if I talk about this, is it's going all the way down here. So when the mitral valve opens up, what happens? The rapid passive ventricular filling will happen. So draw this graph many times because this is an important graph that you should understand. And obviously, your S1 sound is produced around here. If we talk about S2 sound is going to be produced on here, right? And S3 sound is going to be produced down here, and so is S4 too. S4 would be more down here on the atrial contractions, right? If that will be pathological. So this is just like a general concept. Make sure you draw this diagrams many times and try to understand where each events are happening. All right.